Hi, I'm Dr. Richard Jermyn. I'm the Dean of Rowan-Virtua School of Osteopathic Medicine. I'd like to welcome you to the videocast series where I'll be highlighting various thought leaders that contribute to the mission of moving the medical school forward. Today, I want to welcome Dr. Jennifer LeComte, who is the Medical School Director of Rowan-Virtua Regional Integrated Special Needs Center, or known as RISN. Dr. LeComte is a graduate of the Philadelphia College of Osteopathic Medicine. She completed her Med-Peds residency in Delaware at Christiana Care System and Nemours, DuPont Hospital for Children, and a double board certified in internal medicine and pediatrics. As chief resident at Nemours, she initiated her career in providing primary care for patients with complex conditions in childhoods across the lifespan as the founder of the Center for Special Healthcare Needs. She is currently an associate professor for Rowan-Virtua School of Osteopathic Medicine, Internal Medicine, and Pediatric Departments. Welcome, Dr. LeComte. I've been so excited to get you here. So let's talk a little bit.
Sure. I'm excited to be here. Thanks.
My true pleasure. What is RISN?
So it's a lot of words, but RISN Center, as we fondly call it, is a primary care practice for people with intellectual, developmental, and physical disabilities and their families, so that we can improve access to primary care for that patient population, and also really help mitigate caregiver stress for those who take care of the patients that we love.
So do your patients have trouble accessing primary care, and why?
Wow, so ableism really does exist with the patients that I take care of. So what is ableism? It's basically the discrimination of people with different disabilities, and primary care is one of the main places where they don't get access. And unfortunately, when they don't get access to primary care, they die more than their neurotypical peers or people without disabilities.
Can I tell you, it was my true pleasure to work with you during our COVID emergency crisis here. You taught me so much because we had to do things so much different for your patient population than the general population, as you know, and that was sort of my intro in working with you. And I want to thank you for that and your leadership in making sure that your patient population was treated during the COVID-19 emergency.
Yeah, no, what was really exciting about that opportunity was to embed all the other resources that we had. So pet therapy, quiet rooms, sensory rooms. It's all the things that RISN Center has already, but we were able to upscale it to get access to our main mission, which is include people with different abilities in accessing routine preventative health care, vaccines, women's health or reproductive health exams, mammos, colonoscopies. They need it all. They just need it a little bit differently. So that was a great way to show off RISN Center and to show that it wasn't that hard to create a pathway in the way that they needed to receive care. So I think that showing the ease of delivery, one of the most basic things that I try to teach our students and quite frankly our patients to be self-advocates is the most basic ADA accommodation, time. You just need to ask for time and listen. And so I didn't create any of those pathways. The patients just told me what they needed.
Well, true story, whenever I visit RISN, which I love to do, you guys always escort me to the quiet room. You're like, we have a special room for you. And they always escort me there, and I always enjoy it very much. You know, we talk about, you know, mission here all the time, and if there's anything, any center or institute that meets the mission, it's yours. Can you tell me a little bit about how the mission of RISN and SOM and Rowan globally come together?
So thanks for saying that. Part of the reason that I was attracted to Rowan as a school was because of its core mission of serving marginalized patient populations. I happen to have one that I love, but I do think that when you serve marginalized patients and get them better access, because I think really it just comes down to access and wellness, I think that Rowan does it really well. And so I was just able to kind of insert a different marginalized patient population, and then I liken it to clearing the ramp when there's a snowstorm, because then everyone can get in the door. I think each of our mission-based practices that address marginalization synergizes getting the world, as you said, better wellness. And so that's why I think it's important that we're here. It's certainly how we then incorporate all the 4 pillars of what the university looks for, and that's clinical delivery, research, education, and that 4th of economic engine, because without any money, there's no mission. I definitely understand that better now that I've been at Rowan. It just allowed me in a leadership position to really understand that. But I think that it's part of the burnout that we're all experiencing in healthcare. And I think if we can show that we can still maintain our mission and figure out a way to develop an economic engine for serving the people that we want to serve, whoever that is, neurotypical patients, neurodiverse patients, brown, purple, black, white, whatever, if we can meet all of those 4 things, then we can still maintain our values.
So I'm going to kind of maybe skip back a little bit.
Sure.
And you kind of mentioned we really service the community, right? So let's talk a little bit about that perspective. So when you think about servicing a community, what are your goals at RISN?
So we call it, and I'm taking this from a program that I was a part of called Proximity Project. I have no disclosures. I don't get any gains from them, but they really likened, you have to be proximate to the patient population that you want to serve or the community that you want to serve in order to better serve them. So I really feel like these mission-based practices allow students to be closer to the communities that we need to serve, and not just be directive in how we're trying to deliver wellness and access, but really being more receptive to what our community is asking for in helping them become their best selves, their most well selves, the healthiest community. And the communities that we serve, we know right now in South Jersey, they're one of the sickest communities that we can serve. And I think part of the reason why they are is because we haven't embedded ourselves enough in them and asking what they need to be well and healthy. And I think that the mission of Rowan allows us to get back in there and really find out where we can foster what they already have in their communities.
Yeah, I have to say I'm enamored again because you're living this every day, and I'll ask you to give a couple examples. One is when you talk about bringing the community to you and how it's linked in with what we do in medicine, but it's also the education where people, the special needs population becomes part of your everyday. That's a big part of our Sewell location. And you did a couple things, right? You did. You created a cafe, and you also, I believe, at a pretty important groundbreaking where you're bringing a community. Can you tell us a little bit about those?
Sure. So I had a vision for the cafe. I didn't actually get to create it, but certainly it was my vision to make sure that our students, our staff, our faculty see the patients that I serve thriving in the community. And one of the ways to do that is having them have a job where we have to interact with them on a regular basis instead of seeing them at the bedside. And even when they're well in a primary care setting, it still is in that doctor-patient relationship. And so when I say being proximate and bringing the community in, it's about how do we get out and have fun with the people that we're serving and understand what their values are. And one of the ways is through the cafe. The other ways are unity events that we've created, and we've done that together. So when we had our holiday celebration, or our unity celebration, I guess is what we're calling it, we were able to bring musicians who have different abilities in to celebrate with us. And that, again, just empowers people to see people differently, and that they bring joy and value to us when we're doing our celebrations, just like they do in our practices. So those bringing the community and living in the community. So we call them unity events, and that, again, is sort of a borrowed phrase from our colleagues at Special Olympics, who call it unified. So when I first came to Rowan, that was the first group I joined because Special Olympics was really important to me. It's a great opportunity for philanthropy, and I think that physicians have to get closer to philanthropy to continue to serve the patients that they want to serve. It's fun. It gets me moving. So really, to be able to do that when I first came in, I was like, unified, unity events. Wow, they seem like something that we need to do as physicians in order to grow and get our community better at wellness. And that's certainly how we transitioned to the HRSA grant.
So how do we educate the community about everything? And when I say community, I meant our community, right? Hopefully today, more and more people will know what you do and how important it is, but also the community globally about your work.
So this definitely helps, but I do think that when we teach students and we teach our patients, so first is teach your patients to be self-advocates, right? Have them shouting from the rooftops that they need to be heard, especially when they're sitting at our bedsides, right? So that we're making sure that when we are providing services in their community, they're telling us what their needs are, right? So creating self-advocates is number one. Number next is creating soldiers, right? So that's what a med school does, right? That's what graduate medical education does too. So it creates people who choose different fields, who see people of, across all walks of life that are their patients to serve in the future, right? So that's creating more advocates. That gets the community outside of even just our home here to understand that, and then them choosing specialties that include marginalized patients. I think that's how we get it out to the larger community, and then really just promote wellness ourselves.
Yeah, I like that too, right? And I think that is critically important. I'm a big believer in wellness and realizing that it is the foundation for us too, our health, everybody that works here, everybody listening to this video cast. I also want to encourage our students, that are interested in working with Dr. LeComte and research or volunteer situations. There's no end to what we can get you involved in.
There really isn't. So one of the great things that we've been able to do in a really short period of time is we now have at least 8 or 9 SMRF projects. So the summer is a really productive time for us to do research. There is really not enough research for helping us direct our clinical care. So we have that opportunity. We have rotations that it can be an elective. We have longitudinal experiences for some of our residents. So what does that mean? Following someone across their lifespan. That was sort of the design of the Sewell campus too, right? Having to walk through the cafe and seeing people with different abilities at the outset of your medical education, and really seeing that you can bring the community in to provide the services that you need to get your programs up and going. When we brought the cafe in, now the community colleges are employing the same people in the same model. Gosh, if we could do that in the hospitals, right? Where we're actually bringing in, so when we decorate for the seasons, we actually order flowers from some of our communities that serve people with different abilities, right? So you really have to live your mission you're already doing it, right? You're already buying the spring flowers and you're already, getting ready for with the hollies in the season. So why, and the poinsettias. So why not buy them from people who you're serving, right? To help them thrive in the community. Why not go to Black and brown communities and purchase their catering so that we can elevate their community? So we're doing that at RISN and at Rowan and on the Sewell campus, and I think we're all trying to keep infusing our community's resources in the places that we work. We all have to eat lunch, so we go to the Together Cafe and we eat lunch there.
I'm enamored. Mission, training, education, research. You guys do it all at RISN, and I don't know when you sleep. And but I want to thank you. I think this was one of the funnest video casts that we've done. I love your energy.
Thank you.
And I can see why you're such a good doctor to your patients, but also why you're a great community partner. And why you're a great educator. So I want to thank you so much for spending the time educating our audience today on what you do. And I think you're going to be hearing from a lot of people today.
Excited to talk to them.
So have a great day.
Thank you.
Once again, I want to thank our audience today for joining us. Please stay tuned for our next video cast, where once again we'll be highlighting thought leaders that move our mission forward. Have a great day.